If the T3, T4 levels, they go up in the blood, then the patient suffers weight loss, significant weight loss. And vice versa, if T3, T4 hormone levels, they go down. So the patient experiences a lot of weight gain and swelling in the body. Thyroid cancers, they don't cause any weight gain or weight loss. But as I was telling you, that the patient have to undergo a removal of the thyroid gland. So once that thyroid gland is removed, so patient becomes, the T3, T4 levels, they go down.
Hi guys, this is Minidevan and you're watching TheHealthSite.com. Today we have with us Dr. Ankur Truthi, Senior Consultant and Head, Nuclear Medicine at CMCT Manipal Hospital. Hi Dr. Ankur, how are you?
Hello, I'm good.
That's great. I hope you're keeping safe.
Yes.
So, Doctor, since it's Cancer Awareness Month, I think the very first question that comes to my mind right now, and I would like you to enlighten our audiences with, is, let's talk about thyroid cancer today. I think it is something which is not much talked about, yet one of the very important topics. So, if you could firstly explain in brief what exactly is thyroid cancer for you.
As we know about many other cancers, so thyroid cancer is among one of them, which is very common cancer in the females. In the age group of say 45 to 60 years age group, it is very common, and it is a growth in the thyroid gland, which has the ability to spread to different organs in the body, such as lungs and bones. Though it is one of the slow growing tumors, but still if it is not detected early, and if patients continue to neglect it, and if it spreads to the other parts of the body, it can cause a lot of problems to the patients.
Okay, so doctor, are there any particular types of thyroid cancer?
So thyroid cancer per se is a slow growing tumor, and there are particularly three types of thyroid cancers. The first category, which is comprising of approximately 90% of the thyroid tumors, is differentiated thyroid cancer or a papillary thyroid cancer. The other groups, which comprise a small group that is less than 10%, they are medullary thyroid cancers and anaplastic thyroid cancers.
Okay, so what exactly is the difference here, doctor, in these different types?
So the difference lies in the types of cells, the origin of the cells in the thyroid cancers. Basically, thyroid is a butterfly-shaped organ in the neck, which is located in the midline, just below the Adam's apple. And there are mainly two kinds of cells in the thyroid gland. One is the follicular cells, which basically lead to the production of various thyroid hormones. T3 and T4, they are the main two hormones which are produced by the thyroid gland. So the tumors which originate from these follicular cells, these are the differentiated thyroid tumors or papillary thyroid cancer, which we commonly known as. And then there are other parafollicular cells or C cells. So the tumors which originate from these C cells, they are medullary thyroid cancers. So both these tumors, they behave differently for the patient.
Okay. And doctors, what would be the early symptoms for thyroid cancer per se, and how can you really differentiate on the symptoms from those of a regular, perhaps some common aid?
As such, for the patient's perspective, I would like to say that the patient needs to look at any kind of a swelling which appears in the neck, in the midline or on right or left sides of the neck. So any kind of a swelling is the first basic symptom for this thyroid tumor, which needs to be assessed properly and evaluated and by the concerned surgeon or physician. So this is the one most common symptom. Then the other symptoms can be some pain in the neck or some discomfort while swallowing the food or any liquids. Then there can be hoarseness of voice, some changes in the voice. So these are things which the patient should be really concerned about.
But when is the time where one really needs to be alarmed? Because, even if you have symptoms which are similar to cough, you have sour throat, you can have swelling at times. So when is the moment where a patient can really differentiate and perhaps be alarmed enough to visit a doctor?
So I would like to say that any sore throat doesn't need any kind of examination from thyroid cancer point of view. But if it is associated with some nodule or swelling, some any growth, if someone notices in the family also, if some family member notices the growth in somebody's neck, then it needs to be evaluated. If it is associated with this, means if the growth is associated with some other symptoms, then it needs to be investigated.
Also, doctor, so now let's talk about the treatment of thyroid cancer. A, what are the available treatments? B, are there any advancement in the treatments with progressive years?
So, thyroid cancer is mainly treatable, and right now with the good diagnostic modalities available, we are able to diagnose thyroid cancers much earlier as compared to, say, in the early 90s or in early 80s, when most of the thyroid tumors were diagnosed at a later stages. But right now, with increasing availabilities of ultrasound and patients becoming more aware of their symptoms and their bodies, so we are able to diagnose these tumors at a much earlier stage. So regarding the treatment point of view is that if a thyroid cancer is diagnosed at an earlier stage, it is almost curable because it is a slow growing tumor. So the primary modality of treatment for the thyroid cancer is the surgery. In most of the patients, the whole entire thyroid gland is removed, which is known as total thyroidectomy. So this is done by head and neck surgeons. And once this thyroid gland is removed, the chances of the disease coming back is very, very low. But still, the surgery needs to follow up with a radioactive iodine treatment, which is required in almost 90% of cases. So this radioactive iodine is a radioactive treatment which is administered orally. Orally means either through a liquid or a capsule. The patient has to ingest that, and then they have to take some radiation precautions, which means isolating them from their families for 1 or 2 days. And then the purpose of this radioiodine therapy is to reduce the chance of disease coming back to minimal, means less than 1% or 2%. So the gist is that if the patient is diagnosed earlier, means at an early stage, and if they follow the steps of the treatment completely, that is the surgery followed by radioactive iodine, the disease is almost cured for 98 to 99% of patients.
So are there any side effects of the treatment?
Side effects, yes. Any treatment is associated with some side effects. Yes, the surgery has its own inherent side effects. But these side effects are again minimized if you go to a high volume surgeon or an experienced surgeon who is well versed with dealing with these kind of surgeries. In some reputed cancer centers, these surgeons are very much available. A lot of expertise is available right now in India. So the surgery has its side effects like say around 3 to 4% of thyroidectomies, they can damage the parathyroid glands, which are small glands adjacent to the thyroid glands. So those parathyroid glands, once they're damaged, then they can interfere or hinder the calcium levels in the body. So one side effect is this. The other can be there can be some nerve damage, which can lead to hoarseness of voice for the later life. So these things need to be looked at. Then the other part I was telling about radioactive iodine treatment. Radioactive iodine treatment per se does not have a lot of side effects, only small, I can say that small discomfort to the patient in the form of some nausea, vomitings for 1 or 2 days, some gastritis, some inflammation of the salivary glands. So these are small side effects which are easily taken care of by the attending nuclear medicine physician.
But also, doctor, apart from that, it's always thyroid is always linked to weight. There are a lot of I don't know if it's a myth or if it's in actuality, either weight gain or a lot of weight loss. So when we talk about side effects, is this also true? Is this one of the side effects, weight related issues?
Basically, as I was telling you that thyroid gland is involved in the production of various hormones. The primary hormones are T3 and T4. So they basically regulate the metabolic rates of the body. So if the T3, T4 levels, they go up in the blood, then the patient suffers weight loss, significant weight loss. And and vice versa, if T3, T4 hormone levels they go down, so the patient experience a lot of weight gain and swelling in the body. So per se, thyroid cancers, they don't cause any weight gain or weight loss, but as I was telling you, that the patient have to undergo a removal of the thyroid gland. So once that thyroid gland is removed, so patient becomes the T3, T4 levels they go down, and the doctors have to supplement these T4, T3 hormone levels from outside. If they don't take it from outside, then the patient gets definitely he or she will be hypothyroid and will experience weight gain.
So, but it can be with time, can it be maintained back even post surgery?
With proper supplementation of thyroxine hormone, the patient weight will be stable, and only thing is that we have to initially regulate the level, means the doses of that thyroxine hormone for around 1 to 2 months. Once it is regulated, then the patient will not experience any kind of weight loss of it.
Well, I think that's some good news, and I think this has been very, very insightful for all the viewers as well as for me. So thank you for that. Any tips or any advice for all the viewers who are listening to you right now?
Yeah, so my advice would be have a balanced lifestyles with means good amount of exercise, have a balanced diets, go for regular checkups, do self-examination of the body. Don't neglect any kind of cancer-related symptoms or signs, any growths, any bleeding, any significant weight loss without any unknown, means without any reason. So people have to be careful, and then they should avoid smoking, excessive alcohol, etc. So all these things will definitely help us in diagnosing and preventing the cancers and preventing it from becoming a menace for the society.
I think that's great. Thank you so much for sharing such valuable insights, Doctor. Thanks a lot for joining in today.
Thank you. It's my pleasure.
Thank you.